Greetings. Today I'd like to speak to you about my visit to the dentist. I went to the dentist today and I had my teeth scaled and polished. As you can see, I'm very happy with the results. Scale and polish is when the dentist or hygienist uses handheld instruments just to scale and polish your teeth, meaning they will get rid of the plaque and the tartar that will go in between your teeth into all the corners, all the different parts to remove the tartar that can't be removed through brushing alone. So every day I do brush my teeth twice a day. I also floss once a day, and I also use mouthwash when I brush my teeth. However, even though that can help prevent the buildup of plaque, it can't actually remove it. If you look at some of my old videos and you zoom in on my teeth, you will see the evidence of tartar. Disgusting, I know. However, because I knew I had an appointment coming up with the dentist, I just I just thought, hey, it will have to do until I sort myself out. Once you remove your tartar and the plaque, it does minimize, it reduces the risk of gum disease, uh, tooth infection, cavities. It does minimize those risks, and it's an investment in your in the care of your teeth. One of the disadvantages of having a scale and polish is that your teeth do feel quite sensitive for a couple of days. Once you've had it, there might be bleeding and swelling just for a couple of days. I believe the first time you have your scale and polish done is probably the most painful. As you can see, I had it done earlier this morning and I feel absolutely fine. I think the more you have it, the less discomfort you feel. Ideally, you are supposed to have this done every 6 months. Financially, that might look more like once a year. So the risk of the buildup of plaque is down to perhaps not going to the dentist on a regular basis, your diet, what you eat and drink, not flossing, which means you won't be getting into the difficult to reach places, and also perhaps having crooked teeth, whereby it makes it more difficult to brush the in between parts. So those are the risk factors. So once the teeth has been cleaned by the handheld instruments, um, it's then polished, which means the surface is made smooth, so it's more difficult to get a buildup of plaque, and it's just made smooth and shiny. Sometimes due to drinking coffee or drinking tea, we can have stains on our teeth. So the clean and polish is there just to give the teeth an extra shine. It's not the same as teeth whitening, so that's something totally different. I would say this is healthier than teeth whitening because this is literally just taking away the tartar and then smoothing over the teeth. No chemical is being added at all. It's just handheld instruments to remove the buildup of plaque. So this is done by your dentist or your hygienist. The procedure should only take 15-20 minutes, not long. Yeah, 15-20 minutes. Quite noisy because of all the instruments that they use. Um, it can be uncomfortable to be honest with you, but as I said, it's not as painful as when you first go there because obviously you have a tremendous amount of build up which needs to be taken away. And if it's maintained and you go every 6 months, um, it just won't be as painful. So I would advise you to look into your dentist registration, what's closest to you, what's in your local area. You do want to minimize any tooth damage, any tooth infections, gum disease, nerve damage. You just want to minimize that and invest in your personal health care by taking preventative measures. Obviously, having a clean and polish every 6 months does not replace your daily regime of brushing your teeth twice a day, flossing your teeth, using mouthwash. Obviously, doing the scale and polish doesn't replace that, but it's just an added intervention in order to minimize, as I said before, any issues further down the line. Please subscribe to my channel. I hope you've enjoyed my video. If you have any questions, put them in the comments below. Share, comment, subscribe. Thank you.